Healthcare workers in the North Country raised concerns about staffing levels and patient safety.
They're speaking out as contract negotiations continue. NBC5's Blake McQuarrie is live in our Plattsburgh studio with the latest on this. Blake.
Yeah, Lauren, Brian, nurses and healthcare professionals are frustrated. They say staffing shortages inside the hospital are not just a workplace issue, but also a patient safety concern.
It's a travesty to the community, and it's a travesty to the people who work here.
The New York State Nurses Association and healthcare professionals are calling for fair contracts and safer staffing levels at CVPH. The group held a rally outside of the hospital in Plattsburgh on Wednesday.
The hospital wants to eliminate any staffing language that we have that gives us any say in our staffing so that they have total and complete control over it all. So when it falls apart, they also don't have accountability.
Workers say understaffing is a concern, making it harder and leading to less time to deliver the level of care that patients need.
You're forced to make what I call bad or worse decisions, which again leads to burnout. It leads to staying up at night. Did I make the right decision? Did I potentially harm this patient? Is my license at risk? These are very big issues, that are affecting, and when it affects the staff, the end result is it affects the patients.
According to union members, the issue has been building for months. Just last year, they say hospital administrators rolled back some patient safety standards required under New York state law, despite objections from NYSNA members.
What ultimately happened when we said, no, this is not a good idea, management said, we don't care, we're taking it to Michelle LeBeau, who ultimately signed off on it.
Now at the bargaining table, nurses say management is pushing changes that could make conditions worse, even with workers bringing forward solutions to tackle the crisis.
We have proposals on there, again, for trying to retain, trying to keep people, to want to stay here, which again, the hospital does not want to, they just flat out reject, And even when we explain why we're asking for these, they just say, no, we can't do it. We don't have the money.
In a statement, hospital leadership says they share the commitment to providing patients with safe, high-quality care, adding that negotiations are an ongoing process of discussion, proposals, and compromise. And they believe that together they can reach a fair and sustainable agreement for patients, people, and the community.